It's quite clear this crisis, this global crisis, will herald fundamental changes in many of our societies. Great chunks, for example, of the UK economy have already been nationalised, and we've been forced to rethink many of our values. For example, the idea that the British National Health Service could limp along underfunded and overstretched is no longer tolerable. And we are realising how vulnerable our food and medical supplies are, so we will, as a country, have to strengthen domestic supply lines, and most certainly will also have to rebuild the UK's manufacturing base. But perhaps the biggest impact globally will be the realisation that the end of globalisation could arrive sooner than later. That's because in times of emergency, people fall back on the nation state. It alone has the financial and administrative muscle, and of course the emotional cohesion, to weather such terrible national storms. The virus will reinforce existing trends for more local production, economic protectionism, and tougher border controls, and the UN and EU won't like those doses of reality. Neither organisation likes borders, but that is an intellectual conceit. I bet the leaders of both organisations have garden gates, front doors. Meanwhile, political leaders around the world have been asking for help with their economies, help with medical supplies, and help to create that vital, life-saving vaccine. But in a global emergency, national interests invariably come first. For many, it's been a case of every country for itself. And that's why this week the UK's Foreign Secretary, Dominic Raab, appealed for global cooperation to bring countries together to meet the global viral challenge. But to make his job harder, barriers are going up. More than 50 governments have restricted exports of medical supplies, and 33 of those acted after the beginning of March. Land borders are becoming harder to cross. Countries from America to Armenia have placed new restrictions on free movement. So, far from helping, many better-off countries have taken a nationalist turn. Some places, such as the EU, are restricting the export of medical kit, and that goes against the values they profess to hold. China, on the other hand, is winning influence with high-profile deliveries of medical equipment. Poor countries will remember who helped them at this time, and cooperation is key. This pandemic puts doctors, scientists, and policy experts once again at the heart of government. Countries need to work together on treatment protocols, therapeutics, and that vaccine. As past campaigns against malaria, SARS, and HIV showed, it takes a coordinated global effort to roll back a global scourge. It's too late to avoid a large number of deaths, but not too late to come together and avert further catastrophe. But it's the lockdowns that are dominating the headlines, and there are some very small green shoots to suggest they may be working. Spain, for example, has recorded its third consecutive fall in the number of C-19 deaths. It's now standing at 694. By the way, at the same time as announcing the numbers who died, the Spanish Prime Minister also joined the European Commission President in calling for a new Marshall Plan for Europe. France recorded its lowest daily death toll in hospitals, 357 in a week. And in Italy, which has suffered the worst numbers in Europe, the number of hospital deaths, 525, was the lowest in 2 weeks. But the economic toll of lockdowns is mounting, and in Europe pressure will be rising quickly for those lockdowns to be eased because of the damage they're doing to jobless rates, growth rates. For example, Britain is losing an estimated £2.4 billion a day. Businesses, supply chains, public finances, and despite continuing uncertainty over how much immunity infection confers and how quickly a new surge in infection could come. Good weather may already have delivered a sucker punch across the continent by bringing people together in defiance of social distancing rules, but the bottom line is clear. In the absence of mass testing and contact tracing, the Queen in Britain was right. Staying at home is what saves lives.